must be a very busy schedule. Obviously, we're doing it online this year, so I hope that but it works. You know, normally we're in that room with you. I can imagine it must be a bit bizarre because you must be presenting to an empty room at the moment. But hopefully, when we come to do this next year, things return to normal. So in the meantime, yeah, I'm very happy to hand over the floor to Swali for your opening remarks. Thank you so much.
Thank you. Ladies and gentlemen, colleagues, thank you for joining us for this informal dialogue between civil society and UNODC. I'm very pleased to have this chance to speak directly, although unfortunately only virtually, with our NGO partners on the margins of the Commission on Narcotic Drugs. During the opening session 2 days ago, the chairman of the Vienna NGO Committee on Drugs highlighted the role of civil society in addressing drug-related issues and challenges. I could not agree more. Allow me to also take this opportunity to congratulate Mr. Jamie Bridge on his re-election as chair. Civil society is an integral partner for UNODC and for member states in preventing and treating drug abuse and drug-related disorders, and advocating for fair, humane, and effective drug policies that protect the health and human rights of everyone. Your reach on the ground and your voice with policymakers enable us to work with greater impact as we cooperate to assist people in need of treatment and care. Your insights are also very important to us in developing our work and our approaches. I very much look forward to hearing from you. I thank our NGO partners who submitted questions, and I will try to answer as many as I can in the order that we receive the questions before I have to leave for my next appointment. So let's get started. Thank you very much. Over to you, Jamie.
Thank you so much. I really appreciate it. So without further ado, let's go straight to the first question we have on our list, which is from Orsi Feher from the SSDP International. Orsi, the floor and screen is yours.
Thank you, Jamie, and thank you for the VNGOC for organizing these informal hearings every year. So I'm going to jump into my question. First of all, we would like to use this opportunity to commend the UNODC for providing the Youth Forum with a platform to discuss how youth can be more involved in addressing global drug issues. Understanding that a lot of this discussion focused on local efforts, we would like to ask if there are any plans to expand the influence, the power, and/or any opportunities provided to the Youth Forum when engaging with the UNODC or the CND. Particularly during the sessions and during intersessionals. This forum is a key. There was some issues with my, okay. The Youth Forum is a key opportunity for us young people to engage in the drug policy process at the United Nations level. And many of our youth-led organizations, including not only my organizations, but a lot of our local chapters have attempted to get clarity on the selection process for the Youth Forum from our national delegations and governments without any success. So the main chunk of my question is, I guess, if there are any plans to increase the transparency of the selection process or to provide any support to member states to transparently and meaningfully include young people. Thank you.
Thank you, Orsi, for your question. Actually, youth empowerment is very dear to my heart and one of the key enablers identified in the UNODC corporate strategy for 2021-2025. Regarding the Youth Forum, we are currently working on allowing more youth to participate from each country and in languages other than English. A pilot event will take place in Central Asia this year, and we are hoping to extend the pilot to other regions if possible. As for the selection process for the forum, it's the prerogative of the countries to nominate representatives. So each country nominates 1 or 2 representatives to participate in the forum. Many member states do, in fact, organize open competitions and bidding processes, and we certainly encourage such inclusive and transparent practices to include more youth in the dialogue. Thank you.
Thank you so much. Okay, so let's go to the second question, which is actually a merger of questions that we had from the Burundian Association for a Peaceful World Without Drugs, from Forward Sierra Leone, from the Turkish Green Crescent, and from Undogmans Nikta Hetsforbund, Sweden. I do apologize if I'm butchering these names. And this question is going to be read out by a colleague from the Turkish Green Crescent. So I'd like to give the floor to Meryem Nagahan Ulusoy, if you are there, please.
Yes, thank you so much. Thank you for the opportunity. I'll jump into my question then. According to the UNODC's strategy, access to vulnerable segments of the society is a priority for multiple components of drug policy. Does UNODC have any concrete suggestions to mobilize nation states in times of crisis like the COVID-19 that we are facing now? Are there any plans to provide assistance to less affluent countries for reviewing national laws or providing expertise? Thank you in advance for your response and for the opportunity.
Apologies, Ms. Marley. I think we can't hear your microphone at the moment. I do apologize. I can see it's on.
Can you hear me? Thank you, Mariam, very much for your question. One of the major challenges posed by the crisis has been the lack of access in many countries to much needed controlled medicines. Last year, UNODC, together with Incb and WHO, issued an urgent call for equal access to controlled medicines during the pandemic. In addition, UNODC has been engaging directly with policymakers and treatment managers to ensure the continuity of services for people with drug use disorders during the pandemic. We will also be utilizing the joint statement adopted by member states at this CND to draw greater attention to drug issues internationally during the crises. In terms of our support to countries, UNODC is providing legislative assistance on the implementation of the International Drug Control Conventions, as well as advice on elaborating effective and humane national drug control strategies in several member states with a strong focus on building the capacities of the developing countries. Thank you.
Thank you very much. So our third question is another joint submission, or a merged submission, apologies, from the Association for Safer Drug Policies in Sweden and the International Drug Policy Consortium. So can I ask Johan Lindskog, are you with us, Johan?
Yes, I am. Thank you.
Fantastic. Thank you.
Your Excellencies, ladies and gentlemen, the UN Common Position is a groundbreaking document that should guide the work of all UN entities on drug-related matters. It gives UNODC the lead in the implementation task team. What is the UNODC planning to do in 2021 to take the work of the task team further along? Thank you for your attention.
Indeed, UNODC is very proud of its role in the task team on the UN System Common Position. The aim of the Common Position is to enhance assistance to member states and improve the coordination among UN agencies. So this year, the task team will roll out the guidance to UN resident coordinators and country teams with a view to supporting the member states in developing and implementing balanced, comprehensive, and sustainable responses to the world drug problem that are human rights-based as well as development-oriented. So the focus will be on helping the field, the country teams, the resident coordinators and the rollout of the Common Position. Thank you.
Thank you very much. And with that, I'd like to give the floor to Stig-Erik Solheim, who's going to read a question from Actis in Norway.
Thank you, Jamie, for the opportunity to ask this question. Over the past couple of years, it's become increasingly clear that a significant push to change drug laws is now coming from commercial operators in jurisdictions where cannabis has been legalized. I think this may be one of the most significant consequences of the legalization of cannabis and may influence and shape drug policies in countries that still adhere to the global drug policy conventions. What is the UNODC doing to monitor these developments? Thank you.
Thank you, Stig-Erik. This question is mainly about our World Drug Report. Every year, our World Drug Report dedicates a full chapter to addressing developments in jurisdictions regulating the non-medical use of cannabis. So we are following the situation very closely in order to be able to provide member states with accurate information and advice. The World Drug Report reviews the details of implementation of those jurisdictions while looking at different indicators to analyze trends in use and in supply. So UNODC provides research and analysis, delivers technical assistance to address world drug challenges in line with member states' commitments. Addressing compliance with those commitments is the role of Incb, the International Narcotics Control Board, which is mandated to review the compliance of governments with the provisions of international drug control treaties. Thank you.
Thank you so much. And allow me to just take this moment just to remind your colleagues that questions have been pre-submitted for this session. So we aren't able to take questions from the chat box or hands raised. So I do apologize for that, but we have a process where questions are pre-submitted in order for us to be able to manage this session as effectively as possible. So just to remind people about process. So sorry, Ian, didn't mean to take time from you. Straight over to Ian Tennant from the Global Initiative Against Transnational Organised Crime. Thank you.
Thank you very much, Jamie, and thank you, Executive Director, for taking the time to engage with us today. I represent the Global Initiative Against Transnational Organised Crime, but I'm also the Vice Chair of the NGO Alliance on Crime Prevention and Criminal Justice. So we look forward to similar events of these kinds at the CCPCJ and other UNODC meetings. My question is in the context of the generally closing space for civil society that we see across the UN. We see many references in the UNODC strategy for 2021 to 2025 to civil society and a commitment to mainstreaming partnerships with civil society over the coming years across the work of the UNODC. My question is, how will you operationalize this commitment in the coming timeframe? Thank you very much.
Engaging with civil society is a key enabler. It's an important enabler in the new UNODC corporate strategy. And we aim to strengthen our partnerships with NGOs already in place and also to reach out to new stakeholders. So the first thing that we will be doing after putting this at the heart of our strategy, we are starting a mapping exercise through the Vienna NGO Committee on Drugs, as well as the NGO Alliance on Crime Prevention and Criminal Justice and the UNCAC Coalition. So first thing, mapping, then an analysis of the information we have collected to identify the counterparts with whom we can engage at the global, at the regional, and at the national levels. And then we will look at the normative and the operational and research side of our work and see which of these areas of our mandate we can engage with those civil society identified in the mapping with. Thank you.
Thank you very much. So straight over to our next question. I'd like to go to Dianova International and to Lucia Cabana. Lucia, are you with us?
Yes, hello. Thank you very much for your time. As treatment service providers, we now see more people facing at the same time substance use disorders and non-substance addictions, for instance, cannabis use and compulsive online gaming, or alcohol overuse and pathological gambling. My question is, are there any practical initiatives or guidelines by UNODC to help treatment providers deliver better services for these people? Thank you very much.
Thank you, Lucia. It is indeed an important challenge that the UN system is working together to address. The WHO is the lead agency on the treatment and management of addictive behaviors that are not linked to controlled substances. UNODC and WHO have been collaborating in the field of drug dependence treatment and care for more than 10 years now. Our teams are working on guidelines on the treatment and care of comorbidities of drug use disorders that will include all the major mental health conditions, including other addictive behaviors, and I hope that this will go a long way toward filling this gap. So WHO is leading, we are working with them on this. Thank you.
Thank you so much. So our next question will actually be read by Michael Kravitz, but it's the same question. It's on behalf of the FAAAT Think and Do Foundation, or Think and Do Tank, sorry. So Michael, I'd love to give the floor to you if you're there.
Thank you. Hopefully it's working okay. Thank you so for this opportunity. The Foundation for Alternative to Approaches to Addiction Treatment would like to know, with regards to transparency, cohesion, accountability within the United Nations system. As we understand, the INCB Secretariat operates within the administrative and logistical frame of the United Nations as a treaty body. We've been studying the actions of the INCB Secretariat and have not been able to quite understand the relationship it and the board has with the United Nations system, frankly. Is there a guiding document, such as a memorandum of understanding or other governing documentation detailing the relationship, the role, responsibilities, and the oversight applied to the INCB Secretariat? Is it publicly available? And can you share it? And if not, why?
Yes, indeed, Kenzie, there are two documents. They are readily available and easy to find online. These two documents are the documents that define the relationship between INCB, the Secretariat, and UNODC. The first one is the 1961 Single Convention on Narcotics Drugs, which established the INCB. And the second one is the ECOSOC Resolution 9148. The annex to that resolution determines how UNODC, formerly known as UNDCP, provides Secretariat services to the INCB. It decides that the staff providing such services shall be under the direction of the board in matters relating to its functions and powers under the conventions, and that they shall be under the direction of the ED of UNODC in other matters. And both documents, as I said, are available online. You can have access to them easily. Thank you.
Thank you very much. So I'd love to give the floor now to Diana Vincent from the Fourth Wave Foundation in India. Diana, are you with us?
Thank you, Jamie, and thanks to the Executive Director as well. The question, promising strategy for drug prevention, seems to define risk factors and protective factors in the youth environments, and then to address these factors by policies and programs that reduce these risk factors and strengthen the protective factors. This has been an important element in the Icelandic model, prevention model. So my question is, do we have examples of other countries or communities that have used the same strategies? And if so, what have been their experiences?
Thank you very much, Diana. Thank you for your question. Indeed, such strategies are very effective and are recognized by UNODC, WHO, international standards on drug use preventions. Many models of community and youth mobilization have been developed and have been piloted worldwide. I invite you to consult the standards as well as the handbook on youth participation, which was presented to CND last year. For example, for best practices, for examples and for best practices. My staff are also here at your disposal for follow-up questions, so please feel free to get in touch after this meeting to find out about more examples and more best practices. But you can also look up the example of Egypt, where we have worked with youth and we have created youth networks, and we have specifically worked on youth environment on how to address these factors, protection and prevention. So we have a wonderful experience we'll be happy to share with you.
Thank you. Thank you so much.
Thank you very much, Ms. Riley. So that moves us on to our next question, which has been submitted by the Centre on Drug Policy Evaluation. So I'd love to give the floor to Nazli Maksudi, if you're there. Nazli?
Good day. As mentioned, my name is Nazli Maksudi, and I'm with the Centre on Drug Policy and Evaluation in Canada. It's such a privilege to have an opportunity to pose a question today. My question is related to the UN toolkit on synthetic drugs. I know that for some time, at least a couple of years, there has been a dedicated health responses module that has been forthcoming. So I wondered if we could please have an update on this forthcoming module within the UN toolkit. And I'm not referring to the section on health responses within the COVID-19 module, but to a dedicated module on this that has been forthcoming for some time. Thank you very much.
Thank you, Nazli, for your question. We have been making progress on this toolkit indeed. And in fact, since last CND, 2 modules have been released in the health response series. one on access and diversion prevention, and another on treatment and care. Access and diversion prevention offers guidance on ensuring access to controlled medicines for clinical and scientific use while preventing their diversion. Treatment and care provides information, guidelines, and practical tools for the treatment of drug use disorders as well as for opioid overdose prevention and management. Further modules are to be released this year, including on prevention, and they will be all made available online, of course, and be very easily accessible. Thank you, Nazli.
Okay, thank you very much. So the next question again is from IOGT Norway and the Drug Policy Centre in Sweden, and I'm delighted to give the floor to Peter Molainen, who I can see there. If you can unmute, the floor is yours. Thank you, Peter.
Thank you for the opportunity to ask this question. The International Standard on Drug Use Prevention offer excellent guidance, among others the point to the important role of parents for preventing harmful behaviors in children and adolescents. Judging from UNODC's point of view, to what extent have the prevention standards been used by member states, and does UNODC have examples of good parenting programs for from other parts of the world? How could UNODC and civil society organizations stimulate more exchange of experience? Thank you.
Thank you, Peter. We are eager to engage with civil society on fostering exchange of experiences, and I invite you all to use this very forum, the Vienna NGO Committee, to do so, and to reach out to us to organize joint events. In some countries, we have had the possibility to work in a sustained manner for many years, and we have witnessed a change in the culture of prevention that has been documented by independent scientific studies or by member states themselves. We are now working to develop a tool to assess national prevention systems using the standards as a benchmark. In terms of work on family skills, our own two programs, Strong Families and Families United, have been piloted in Asia, and we are in the process of piloting them in other regions as well. So please go ahead and do engage with us in these two programs. Thank you, Peter.
Thank you so much, Ms. Wari. Okay, so our next question comes from Colombia, from Fundación Prever, and it's from Gloria de Salvador. So Gloria, can I ask if you're there and you're able to take the floor? Gloria, are you with us? Okay, in Gloria's absence, if you'll indulge me, Ms. Wiley, can I read out the question on her behalf?
All right.
Okay, thank you. So the question is that the statistics show that young people and teenagers start consuming at an early age, which justifies outpatient medical programs helping to prevent social exclusion. How could a training and experience sharing program be created? Thank you very much.
Thank you. Actually, this question is a very important one. UNODC has created TreatNet family precisely to address this gap. As you know, there's a good base of evidence for using family therapy to address drug use disorders in adolescents. Through TreatNet family, UNODC has distilled the key elements from many models of family therapy, and it has been piloted in Indonesia, in Vietnam, with reports of positive treatment results for both youth and families. So the materials are online, and my colleagues here are at your disposal to provide more information on this. So if Gloria wants to get in touch with us later, we will be able to provide her with the answers. Thank you, Jamie.
Okay, thank you. That's much appreciated. Thank you very much. And for the next question, it's from Acid in Costa Rica, Ernesto Cortez. I can't see Ernesto on the participants list. So Ernesto, are you there? Because if not, I'll just read this one as well, if you'll indulge me. So the question is, how can we improve and assure a greater involvement of people who use drugs in the HIV response in Latin America? Thank you, Ms. Wiley.
So to answer Ernesto's question, inclusion is a priority across UNODC's work. And again, it is mentioned in the corporate strategy very clearly as an enabler, and it's part of how we work. In all regions, including Latin America, our office is advocating for a people-centered approach that supports, funds, and empowers community-based organizations, including organizations and networks of people who use drugs, in all aspects of the design, implementation, and monitoring and evaluation of the delivery of HIV, health, and social protection services. We have also been engaging with civil society on this issue through UNODC CSO group on drug use and HIV, allowing for more effective collaboration and joint initiatives and support inclusivity. And we work very closely, of course, with UNAIDS. Thank you, Ernesto.
Thank you very much. For the next question, I can see that Eric Davis. This is from the Community of Anti-Drug Coalitions of America, CADCA. Eric Sierra, the floor is yours. Thank you so much.
Thank you, Jamie, for the opportunity, and to the Executive Director for her time today. So our question is, children who first smoke marijuana under the age of 14 are more than 5 times as likely to have a substance use disorder as adults than those who first used marijuana at age 18. In addition, substance use prevention is a sound investment, with every dollar invested having a potential to result in savings between $2 and $20. Despite these facts, however, substance use prevention has been underutilized and under-resourced relative to its ability to reduce population-level rates of substance use disorders and related issues. Please explain how UNODC, INCB, and WHO will work together to ensure that substance use prevention is a higher priority for emphasizing and designing, developing, and implementing responses to the world's drug problems. Thank you.
Thank you very much. A very important question indeed. Prevention of drug use and related risky behavior is a cornerstone of our work on drug issues. Successful prevention requires parallel efforts, working on the policy level while also engaging communities directly. We are working with policymakers in several countries to improve national prevention approaches, guided by the UNODC WHO International Standards for Drug Use Prevention. At the same time, we are developing and piloting evidence-based programs for families and schools at the national level, reaching 95,000 family members last year only. We are currently developing an app to reach parents in the midst of the current circumstances. We are also working to mobilize the unique contribution of youth. One example is our work with Japan's Drug Abuse Prevention Center, which provides grants to fund drug prevention initiatives for youth and by youth. So that's a very important example that we can benefit from and maybe replicate in other countries. Thank you.
Thank you so much. So our penultimate question from the submitted question is from Association Prieto in Spain, and I'm pleased to give the floor now to Elena Presencio, who's going to give this question for us. Thank you, Elena.
Thank you for the opportunity. My question is, according to the 2013 to 2019 report of Proyecto Hombre Observatory in Spain on the profile of people with addiction problems, about 65% of people who started treatment in our organization have not studied or only finalized primary education, and only 38% were employed when started the treatment, most of which in precarious conditions. Women are disproportionately affected, as the study shows that more than 72% were unemployed. For more information, please see Proyecto Hombre website. In fact, such difficulties will only be aggravated as a result of the COVID-19 pandemic. What policies and measures should be promoted to support the social labor insertion of people with addiction problems? What policies and measures should be promoted for the effective integration of the gender perspective in social labor insertion policies? Thank you.
Thank you, Elena. We do recognize very much that supporting social reintegration in the community, including through employment, is an essential part of the effective long-term management of recovery, which cannot focus only on preventing relapse. Crucially, these efforts should incorporate participation and integration in educational and vocational pursuits, including volunteering, active involvement in initiatives to reduce the burden of stigma and discrimination, which, as you correctly pointed out, affects women more than men. Some of the training that we provide to policymakers and treatment officers on care, treatment, rehabilitation, and reintegration covers the particular challenges that women face and address how to provide services tailored to their specific needs. Thank you.
Thank you so much. And then our final submitted question today is from the Veterans Action Council in the USA. So I'd love to give the floor now to Ricardo Pereira, who I can see you there, so please unmute and the floor is yours. Thank you so much.
Yes, sir, thank you. And thank you for the opportunity to address this body. It's an honor and a privilege. The Veterans Action Council would like to know, given the spirit of the treaty and the recent change of status for cannabis from a prohibitively controlled narcotic to a recognized medicine, what are the obligations of each state to adhere to this new international law? And what enforcement mechanisms are in place to protect the rights of patients to access and benefit from this important medicine? Thank you very much for your time.
Thank you. Actually, the state obligations under the International Drug Control Conventions is under the purview of the International Narcotics Control Board and Incb, and I can only refer you to them. In terms of medical and scientific uses of cannabis, the text of the 1961 Convention always permitted state parties to pursue medical and scientific uses of controlled substances. UNODC continues to work with the WHO and the INCB to assist member states in improving accessibility and availability of controlled substances for medical and scientific purposes, while at the same time preventing their diversion and misuse in line with their obligations and commitments. So I hope this has answered your questions. And Jamie and colleagues, I'm afraid I'm out of time, so I will have to leave you in the good hands of the divisional directors, who will remain at your disposal to answer any further questions. Thank you for taking part in this dialogue, and I very much hope that we meet as many of you in person soon, perhaps in the next CND session, and that if I have the opportunity to visit your projects and programs on the ground in your countries and regions, to see your work helping people who need us most. Thank you once again for your cooperation with UNODC, and I wish you a productive CND, and the colleagues will continue with you the session. Thank you very much.
Thank you so much, Ms. Wiley, and thanks for your time, and we wish you all the best for the remainder of the week, because I can, as I said, can only imagine how busy it must be from your side. So yes, other colleagues, Jean-Luc and Mira and others, I believe if you're staying with us, that would be a fantastic opportunity now for any of our participants on the call from NGOs, whether there's a follow-up question or whether you have any additional questions. I would encourage you to raise your hand at this point. But first, maybe Jean-Luc, if I can give you the floor in case there's any additional comments you'd like to make at this point from the question that we already had.
Thank you, Jamie. I mean, only to say that I have here John and Mira still on board next to me, so that we do hope, next to Mirella on my left-hand side, to be able to take on any other questions until the clock of 4, where we need to rush to other meetings and other appointments. So Jamie, go ahead and let's see how far we can get.
Okay, fantastic. And sorry, John, I couldn't see you on the screen there. I do apologize, John, but lovely to see you as well. So I would encourage basically any NGO colleagues who would like to speak, please let us know either in the chat or I would encourage you, there's an opportunity now to unmute. I think, Amy, did you have a follow-up question? In which case, I don't know, Sarah, do we need to give Amy permission to unmute her mic?
Hi, Jamie. Let's see. Let me turn on the video.
Hi, Amy. Thank you. Over to you.
Hi. I didn't mean to actually say penalty, but my question is, are there countries like the USA have been studying cannabis and promoting funding for the studies of cannabis as medical access.
Oh, sorry, Amy. I think we've accidentally muted you. Can we unmute Amy, please? I'm so sorry. Amy, sorry, please carry on.
Sorry.
I do apologize.
Did you not hear any of it?
Well, I think we got as far as you said, but let's start again, and then we can make sure that colleagues get the full question. Thank you.
My question surrounds the obligation of countries to share information about medical utility for prohibited substances. For instance, the United States has been funding medical cannabis studies in other countries outside of the US, and in the US has only promoted the study of cannabis from a harm model, thereby limiting access to medical cannabis utility that has been verified by funding and other countries. Can there be some form to make these countries share this information that they're aware of to increase access and availability with science-based evidence?
Thank you. So over to our UNODC colleagues. Thank you so much.
Okay. We were just consulting a bit here around the table to see who was taking this on. I mean, from my side, Amy, I mean, I can tell you that evidently what is happening in the world of narcotics overall is of keen interest to UNODC and our research team. You do know that the Division of Policy and Analysis, for which I'm responsible, deals with the research. The World Drug Report, I mean, it gives you a great overview about what is happening, and we do refer to all national studies and research available to us, so that is very, very clear. When it concerns the cannabis, evidently with the new situations as we witness them evolving still today, we are trying to track them as well. We are in close consultation with national authorities to collect as much evidence as feasible and to try to derive as much as we can in the current situation. I mean, knowing that the effects of the legalization on cannabis might take much longer, I mean, to fully fledged to be available, become available. But as we go, we do follow up, I mean, incrementally and collect data. With regard to the, yes, I mean, there is evidently as well the work of WHO to the same. The World Drug Report is a kind of a common work with many. We do have as well an scientific advisory committee, I mean, to ensure that we are really on track. So it is, I would say, still the gold standard when it comes to research and evidence, including cannabis, but as well any other illicit narcotic drug. Information exchange on as well being done, I mean, through the mechanisms of the Incb. But on the medical part, as John corrects me, indeed, that is being done through WHO. Amy, is that answering your question?
Thank you. I think Amy may have actually, we may have lost her slightly during that answer, but I think she's rejoined now. But thank you so much, Jean-Luc. Can I ask now if there's any other questions that colleagues on the call may have? It's a good opportunity to pose our questions to Miwa, to Jean-Luc, to Mirella, to John. On the panel. Any additional questions at all? Okay, we have a short comment from, sorry, I can't see who that's from. Oh, Michael, please, back over to you. Please, please unmute. Michael Kravitz. Are you there?
Yes, I'm here. Hopefully my computer screen isn't catching up as fast as evidently the network is. My question is really very simple. I just want to compliment everyone. Thanks again to the NGO committee for this great meeting, and the UN Office on Drugs and Crime for the thoughtful and careful answers. Just basically an offer more than anything. Within the United States, we're working in 36 states now with what we're calling modern medical cannabis access laws. And we now have 16 states, including the one I'm sitting in, Virginia, where we've passed adult regulated access programs. And really as an offer, you know, recognizing that the United States federal government has not yet changed its federal law, and you work with federal governments. This is an offer, sort of back channel communication, if you will, that the cannabis movement is offering to the UNODC to have access to any of the information in any of the states inside of the United States that you think would be relevant or interesting directly from the source, from the patients, from the caregivers, from the distributors, from the regulators, from the legislators, and that's my personal offer.
Okay, thank you.
Thank you. Thank you much, Michael. I mean, the offer is well taken, and thank you as well for the compliments. They are due to the VNGOC. I mean, they really have been enabling to move this process forward. It is indeed an annual tradition, which we from the UNODC side do cherish as well very, very much. But thank you, Michael, for the offer. Over to you again.
Thank you, Jean-Luc. So I have two questions in the queue. One from Marie Nougier from the International Drug Policy Consortium. So I'll hand to you first, Marie. And then George, I see you also have your hand raised. So Marie first, and then George. Marie, thank you.
Thank you very much, and thanks so much for taking additional questions. I know you're always really busy at the CND. So my question is regarding the drafting of the UNODC World Drug Reports every year. As you know, many UN agencies are launching calls for contributions ahead of their reports, providing opportunities for civil society, but also from member states and other UN agencies to provide inputs into these reports. And I was wondering whether there was any possibility for UNODC to do this as well as an opportunity to show how civil society can provide meaningful contributions for the World Drug Report. Thank you.
Thank you, Marie. And I think you're as busy this week as we are. I mean, I have seen you very active in many of the side events, so good to see you back again. Well, with regard to the drafting of the World Drug Report, which is an extremely cumbersome and an exhaustive task, we do have approved by the CND our new annual questionnaire, which has gone out, I mean, to the member states as such, and in which we indeed hope to collect through the national governments a comprehensive series of data coming from different agents within the national context. But within that very broad questionnaire, which is reviewed and approved by the national governments itself, I mean, we do hope indeed to collect as much of the information available. Having said that, I mean, this is not the only source on which we base our question, the report itself. We evidently, I mean, look as well in all the academic journals. We do have a scientific advisory committee. So we're tapping in many different sources, I mean, to make sure that those who do not contribute or do not fully contribute within the annual questionnaires, that we still get an accurate, or let's say differently, an as accurate picture as feasible in the context of many data gaps. Over to you again.
Thank you so much, Jean-Luc. So George, I'd like to give you the floor now, George, from the Slum Child Foundation in Kenya. Thank you.
Thank you very much for the opportunity. My name is George Ochieng from Slum Child Foundation. My question goes to the UNODC prevention team. I think 2-3 years ago, they launched a project in, it was in Zanzibar. They were doing a project on prevention, I think family strengthening, something of that sort, in Zanzibar and Kenya. And based on the response from the executive director from UNODC, she has just mentioned about the other continents, the progress that they're having in place and so on and so forth. So I just wanted to know how far they've gone with that project, and is it possible for other civil society organizations like our organization to be involved in this? Because we've been waiting for the pilot project to be done. And then the pilot project has been done. So we don't know if it has been completed or it is just hanging. Kindly, I would be very much happy to hear about the progress and how we can be part of that family strengthening program that I think, if I'm not wrong, you're also doing with UNHCR. Thank you for the opportunity.
Thank you, George.
Thank you, George. I mean, and congratulations. I see that you are a proud family father of multiple little kids behind you. So let's start with the family prevention there in that case. I mean, very nice, George. Well, I mean, I don't think that we have that precise answer available on that specific project in Zanzibar, George, but we definitely will look up. And if you would be so kind, I mean, to involve Mirella, who then can contact the division involved and make sure that we get the precise information on that specific program to you and see how we can explore eventual collaboration. Over to you again.
Thank you so much, John. So I see we have a question from Kelly Baker from the Cannabis Education Guild in Canada. So Kelly, happy to give the floor to you. And then we have a few other colleagues with their hands raised, so I'll come to them afterwards if there's still time. So Kelly, over to you. Thank you. You're still on mute, it seems. I don't know, maybe, Sarah, do we have to give Kelly permission to unmute?
Can you hear me now?
Yes, perfect. Thank you. Over to you.
Thank you, Jamie. My question is, what policies is the UNODC developing to ensure small, medium, and large-size corporations operate transparently, require social policy integration, and enforce accountability for human rights practices to prevent labor exploitation in the current and future cannabis supply chain?
Kelly, that's a very interesting question, and many thanks for that. But oh my goodness, it's a hard one. I mean, first of all, within the UN family, I mean, we work through the UN Global Compact with the private companies and the private industry. We are as well, I mean, looking more and more within the overall portfolio of the ESGs, and we do that, I mean, forgive me the other abbreviation, within the context of the SDGs, from ESG to SDG. Now, I hope you still can follow me on that one. And to do that, we do have a GRI, which we are promoting. And the GRI is basically the matrix in which we try to measure, indeed, the corporate responsibilities. So there's a lot of work being done within the UN on the entire framework. It's extremely interesting. We're absolutely delighted to see how many companies are now promoting the ESG concepts. But evidently, this needs to go beyond only, how would you say it, goodwill and eventually less benign public relations and marketing instead of realities. And that's why, again, I mean, we try to have the GRI coming in place where we can measure the real progress made within those companies. My apologies for the technical explanation, but I see you nodding, so you know what I'm saying.
Thank you so much, Olu. Yeah, we're all very familiar with all the acronyms. So yeah, we have some hands raised, so I'll try to address those in the order that I saw them. So first over to you, Dave Borden from DRCnet in the USA.
Hi, it's David Borden with DRCnet Foundation, also known as StopTheDrugWar.org. It was, and I hope it's okay that I'm making a brief comment rather than a question specifically. A characterization was made earlier to the effect of marijuana legalization in the United States being driven by commercial interests. Actually, what we tend to see is that businesses will stay out of funding initiatives because they don't have to. They're NGOs who have the resources and the mandate to carry out this activism. So the businesses instead put their money in later to influence how the laws are regulated. The business community actually is divided on the question of legalization, and we sometimes see businesses that are heavily invested in and profiting from a medical model opposing legalization initiatives. Most recently, we've seen movement towards legalization in state legislatures, and this appears to be driven by a combination of the popularity of the issue in the United States, together with the desire of legislators for them to be the ones who regulate the trade rather than the authors of the initiatives. Thank you.
Thank you, Dave. I'm not sure, I mean, what I can say on that. I mean, it's a very internal debate which is happening within the United States at its current stage. I mean, it's a debate, I mean, which I think divides members of our member states within the United Nations framework. No doubt, which is as well a very lively and rich debate within the Vienna NGO committee as it is in the business sectors. I thing that we do have when it comes to the legal frameworks to refer to the International Narcotics Control Board, who is, I mean, by treaty bounded mandate, basically the watchdog on the compliance of national governments with the treaties. And I am not ready to venture more deeply in what you indeed have called a comment, which by itself would fill a few side events within the Commission on Narcotic Drugs. So over to you again.
Okay, thank you, Jean-Luc. So I see the time, so I think we have maybe time for one more question, and the next hand I have raised is from Crispin Okello. So Crispin, if you're able to unmute, the floor is yours. And I don't know, again, Sarah, maybe we need to give Crispin permission to unmute. No. Okay, again, in the interest of time, then maybe I can go to the last hand we have raised, which is Jim Cleary. Jim, are you able to unmute?
Yes, I am.
Yeah, okay, brilliant. Thank you.
I'm a medical oncologist, palliative care physician at the University of Indiana in the United States. Our track record on making controlled substances is not being good for cancer patients, palliative care patients. I am excited about marijuana, cannabinoids actually being approved medically. But looking at the track record, is this actually going to work? Can we as a world, globe, make available, and can we actually improve access to opioids as we move forward and improving access to cannabinoids?
Thank you, Jim. I mean, I think that this is one of the core questions being discussed at the current Commission on Narcotic Drugs. There is a resolution being negotiated on the accessibility of controlled medicines. It is indeed, I mean, rather paradoxical that at one hand we seem that the diversion of the controlled drugs is happening at the levels which we're witnessing, and that those, I mean, who need to have the access for all good medical reasons are deprived of them. It's a difficult question. I mean, it's a question as well, I mean, which is being raised within the expert commission on drug dependency, which is, as you do know, established to make recommendations of WHO, whereas then WHO, I mean, put them forward to the Commission on Narcotic Drugs for a vote by the Commission on Narcotic Drugs. It's a very hard balance, and I'm regretting to say that at this moment, far too many who medically would be justified to get access to those controlled medicines regretfully do not fall within that category of those benefiting from it. Jim, not more I can add at this stage.
Thank you, Jean-Luc.
Okay, Jean-Luc, I have one more hand raised. Do we have permission to take one last question before we let you go?
If I get the email address of that person so that my next chairman can then complain to that person directly, that's okay. Fire off.
It's a deal. It's a deal. Crispin, over to you, please. Oh, you're still
thank you.
Yeah.
My name is Crispin from Child Space Organization in Kenya. And, I'm so excited to be here. My straight question is a concern. You see, young people tend to believe their age mates. They believe whatever the information they get from age mates. So my question is, how can UNODC be able to amplify the voices the most affected youth from there, especially with specific ages, certain people, and ensure that these marginalized groups are at the highest level, of understanding of what UNODC is doing and strategies to ensure that their issues are captured.
Okay, thank you. Did you manage to catch that, John?
Christine, I mean, I only partly got what you were trying to say, and my apologies, we will not have time anymore to correct if I'm wrong. But if I understand well, I mean, this is related to prevention, especially directed towards adolescents, and how we indeed, can compete with the other interests, I mean, on the outside, which apparently seem to be very appealing to certain segments of the population. I mean, that's exactly what we try to put within that standards and guidelines which we have on prevention. And it is not starting with the age of the adolescents. It needs to start much earlier. I mean, we really need to have an integrated prevention program rolled out. And that is indispensable, even for those places, I mean, where you do have no cannabis legalization. The emphasis on your prevention remains as strong and as necessary. I mean, I would leave it up to there, I mean, knowing that time is running out. But allow me, I mean, Jamie, again, to congratulate you with the re-election as a chair of the VNGOC. And to thank you all for being present with us and to have been engaging with us. I see many, many faces, I mean, who I recognize, I mean, from the corridors within a normal commission, and we only can hope that we soon can meet each other again at the coffee bars of the M building. Regretfully, that is not yet happening.
Oh, thank you so
Over
much,
to you.
Dr. We really, really appreciate your time and that of your colleagues as well, and obviously with Miss Wiley as well. So thank you so much. Thank you everyone for joining us. And yeah, we'll see you in the forthcoming meetings over the next few days. Thank you.
Cheers.